Good morning everyone. Myself Sanjita Pandit. Welcome back to channel Medical with Sanju. Today question on APH, antepartum hemorrhage. The antepartum hemorrhage ma main placenta previa and abruptia placenta आउँछ. Question number 513. Placenta previa and abruptia placenta are example of option A, antepartum hemorrhage, option B, postpartum hemorrhage, option C, eclampsia, and option D, vesicular mole. Placenta previa and abruptia placenta are example of antepartum hemorrhage. Option A is right answer. Antepartum hemorrhage means excessive bleeding lost from 24th week of pregnancy to before onset of labor. र यदि 24 विक्स भन्दा पहिला चाहिँ ब्लिडिङ भएको छ भने त्यो केसलाई एबोर्सन भन्छ र आफ्टर 24th बिफोर onset of labor is antepartum hemorrhage. 70% causes हुन्छ APH को placental bleeding जसमा placental previa 35% and abruptio placenta 35% हुन्छ र other 25% causes चाहिँ spontaneous or induced abortion, ruptured ectopic pregnancy and some other unexplained causes पनि हुन्छ. Question number 514. Woman is 37 weeks pregnant and she is bleeding profusely with no pain is suggestive of option A, antepartum hemorrhage, option B, unavoidable hemorrhage, option C, accidental hemorrhage, and option D, concealed hemorrhage. Bleeding that occur from 24th week to before onset of labor is antepartum hemorrhage. Option A is right answer. Question number 515. Antepartum hemorrhage is associated with all of the following except option A, postpartum hemorrhage, option B, option C, increased perinatal mortality, and option D, postpartum pregnancy. Antepartum hemorrhage may cause postpartum hemorrhage, anemia, increased perinatal mortality, and premature labor, not postpartum pregnancy. है ना APH को कारणले postpartum hemorrhage पनि हुन सक्छ, एम्नोरिया हुन सक्छ, पेरिनेटल मोर्टालिटी रेट इन्क्रिज हुन सक्छ तर postpartum pregnancy सँग यसको कुनै रिलेसन छैन. सो अप्सन डी इज राइट आन्सर. क्वेशन नम्बर 516. Vaginal bleeding after 28th week of pregnancy, which is sudden, onset, painless, causeless, and recurrent, is known as option A, abortion, option B, abruptio placenta, option C, placenta previa, and option D, भाषा previa. यदि क्वेशनमा पेनलेस दिएको छ भने प्लेसेन्टा प्रेभियामा टिक लगाउनु होला हैन. प्लेसेन्टा प्रेभियामा पेनलेस ब्लिडिङ हुन्छ. Placenta previa भन्नुको अर्थ placenta is situated or implanted in the lower uterine segment and it's characterized by painless, bright red, current vaginal bleeding during rest, low BP, uterus feel relaxed, soft and elastic, floating head of fetus and feature of anemia. Bleeding may be start from 12th week, second trimester of pregnancy र abruptio placenta third trimester मा हुन्छ. Placenta previa second trimester मा and abruptio placenta third trimester मा. Right answer option C, placenta previa. Question number 517. What is the color of blood in placenta previa? Option A, bright red, option B, brick red, option C, brown red, and option D, none of above. Let's just भनेको the characteristics of placenta previa is painless, bright red color, vaginal bleeding, low BP, uterine feel relaxed, etc. ना सो प्लेसेन्टा प्रिभियामा ब्राइट रेड कलरको ब्लिडिङ हुन्छ अप्सन ए इज राइट एन्सर क्वेसन नम्बर 518 A client arrives at the hospital at 38 weeks gestation with profuse vaginal bleeding. She stated that it occurred suddenly without any contraction. Which condition may the client be experiencing that required immediate notifications of the healthcare provider? Option A, placenta previa. Option B, concealed abruption. Option C, placenta accreta. And option D, ruptured uterus. Profuse vaginal bleeding and without any contraction means painless vaginal bleeding. That is a placenta previa. Option A is right answer. Question number 519. Signs and symptoms of placenta previa include option A, sharp abdominal pain. Option B, yearly rupture of membrane. Option C, increased low back pain. And option D, painless vaginal bleeding. Painless vaginal bleeding is the main sign and symptoms of placenta previa. Option D is right answer. Question number 520. Placenta previa is characterized by all of the following except option A, painless bleeding. Option B, present in first trimester. Option C, causeless bleeding. And option D, recurrent bleeding. Present in first trimester. Option B is right answer. Listen here. यदि फर्स्ट ट्राइमेस्टर्समा ब्लिडिङ भएको छ भने त्यो केसलाई एबोर्सन भन्छ सेकेन्ड ट्राइमेस्टर्स एन्ड थर्ड ट्राइमेस्टर्समा ब्लिडिङ भयो भने त्यो केसलाई एन्टिपार्टम हेमोरेज भनिन्छ तर यदि सेकेन्ड ट्राइमेस्टर्समा ब्लिडिङ भयो भने त्यो प्लेसेन्टा प्रिभिया हुन्छ र थर्ड ट्राइमेस्टर्समा ब्लिडिङ भयो भने एब्रुप्टियो प्लेसेन्टा हुन्छ क्वेशन नम्बर 521 following is risk associated with placenta previa. Option A, disseminated intravascular coagulation. Option B, chronic hypertension. Option C, antepartum hemorrhage. And option D, infection. Antepartum hemorrhage. Option C is right answer. Question number 522. Possibilities of a common complication after delivery into a mother suffering with option A, infertility, option B, uterine atonicity, option C, hemorrhage, and option D, amenorrhea. Common complication is hemorrhage. Option C is right answer. Question number 523. Maternal complication during labor in placenta previa. Option A, yearly rupture of membrane. Option B, asphyxia. Option C, low birth weight babies. And option D, birth injuries. Yearly rupture of membrane is right answer. Question number 524. An occurrence in which umbilical cord vessel pass through placental membranes and lie across the cervical OS is termed as option A, abruptio placenta, option B, placenta previa, option C, placenta accreta, and option D, vasa previa. Presenting the blood vessel of the umbilical cord before the presenting part of fetus in front of cervical OS is called as vasa previa. Option D is right answer. Question number 525. Which of the following is termed as the fetal blood vessel lying over the internal OS in front of presenting part? Option A, vasa previa. Option B, cord presentation. Option C, cord prolapse. And option D, occult cord prolapse. This one is vasa previa. Option A is right answer. Question number 526. Among the following, The event during pregnancy that required immediate attention by the physician is option A, backache, option B, bleeding for vagina, option C, dependent paddle edema, and option D, frequency of micturition. ब्लिडिङ पर भेजाइना छ भने इमिडिएट चाहिँ एक्सन लिनुपर्छ अप्सन बी इज राइट आन्सर क्वेशन नम्बर 527 म्यानेजमेन्ट ड्युरिङ माइनर प्लेसेन्टा प्रिभिया अप्सन ए ब्लड ट्रान्सफ्युजन अप्सन बी कम्प्लिट रेस्ट अप्सन सी सेजेसनल सेक्सन एन्ड अप्सन डी ड्रग थेरापी Management of placenta previa, mainly minor placenta previa, include absolute bed rest and limitation of activities under close supervision to extend the period of gestation until 36 weeks, when fetal lungs maturity is likely to occur. Lung mature can also be situated by administering dexamethasone 48 hours before delivery. Prophylactic medication, IV fluid, and blood transfusion may require depending on severity of bleeding. A sejational section is required if complete placenta previa छ भने complete bed rest. Question number 528. Mother is diagnosed with a partial placenta previa. The nurse tells the client that the usual treatment for partial placenta previa is option A, bed rest, option B, administration of platelets, option C, immediate sejational section delivery, and option D, induction of labor with oxytocin. Right answer is option A, bed rest. Next question in other video. Thank you so much.